One type of skin issue you might often notice is a skin tag, a small growth connected to your body by a thin stalk of skin. Now, skin tags can be irritating little growths that raises a lot of questions, especially because they can be a sign of major metabolic issue which might be coming up or may have already started inside your body. So watch till the end to know when these simple skin tags could be a sign of something more grave and dangerous, and you may need to take certain steps right now. So skin tags are extremely common, occurring in approximately 50% of adults. The precise cause of skin tags is currently unknown. However, because they tend to grow at certain sites where the skin rubs together, they more often or commonly affect overweight people who may have excess folds of skin and suffer from skin chafing. Now, skin tags are very common and generally occur between the age of 30 and 50. So, skin tags are made up of loose collagen fibers or protein fibers and blood vessels encased in skin and can develop equally in men and women but uncommon in children. So, skin tags do not affect your health, but they can look very ugly. If they are in the areas like face and neck, they can make you self-conscious. In some occasions, a growth that looks like a skin tag may sometimes be else, like a wart, mole, or even skin cancer. So skin tags are not the same as warts or moles. Moles are pink, tan, or brown in color, whereas the skin tags may be of similar color as rest of your skin. While some moles can be raised, they tend to be usually fat and round and oval shaped. In some cases, moles can develop even into skin cancer, that's melanoma. And warts, like skin tags, may be of the same color as rest of your skin. However, they tend to have rough texture. And unlike skin tags, which has no clear cause, warts are usually caused by virus that can spread from one person to another. Now, like warts, skin tags do not grow back after removal. You should see a dermatologist or an experienced homeopathic specialist to get an accurate diagnosis and treatment for it. They tend to form in skin folds, as I already said, and areas where natural movement causes the skin to rub against each other. Often suspended on a slender or thin stalk, these smooth and soft skin-colored skin lesions are frequently found in neck, armpits, around the groin, under the breast or eyelids, and consist of loose protein fibers and blood vessels surrounded by skin. They can vary in color and size from a few millimeters up to 5 centimeters wide, and unlike warts, are not contagious. Pregnant women are more likely to develop skin tags, although they usually disappear after the baby is born. Skin tags can be mostly also due to hormonal changes and increased levels of growth factors. Multiple tags can be a sign of hormonal imbalance or an endocrine problem in females. People with high resistance to insulin are also more at risk, and some studies have shown that as few as even 3 skin tags are linked to increased risk of diabetes type 2. The research shows that those with skin tags have higher cholesterol, higher blood sugar, and a higher level of fat in the blood, that's high triglycerides, all of which are risk factors for developing full-blown diabetes type 2 and coronary or heart disease. In general, skin tags doesn't require treatment, and smaller ones may simply rub off or fall by itself. However, you may consider having them removed for some cosmetic reasons. But it's not a good idea to try to remove skin tags by yourself at home, since they can cause bleeding and get infected easily. If you have a small skin tag, you could ask your doctor how to remove it at home. Now, skin tags that are insulin related are sometimes accompanied by dark thickening of skin in the skin folds, which is called as acanthosis nigricans also an early sign of diabetes. So we may also want to watch out for this sign. Frequently appearing around the back of the neck, this sign often looks as if skin has been stained by your back necklace. It is important not to ignore these crucial warning signs because insulin resistance is a growing metabolic abnormality worldwide, especially here in India, and plays a significant part in increased death rate also. In order to lower your risk of prediabetes and type 2 diabetes, you should visit a Welling clinic near you for natural homeopathic treatment for prediabetes and diabetes type 2. That's all for today's episode. See you all in my next episode of Dr. Welling's Health Show. This is Dr. Welling signing off. Bye and take care.